Human papillomavirus, or HPV, is a diverse and contagious virus that affects both the genitals and the mouth. Infection of the mouth is usually referred to as oral HPV. With more than 40 sexually transmitted forms of oral HPV, the DNA virus can cause wart-like growths on the tissue. Oral HPV is typically transmitted through direct contact between uninfected individuals and infected oral or genital tissues. Oral HPV enters the body through the epithelial tears, often caused by friction. Upon entry, the virus infects the basal cells where symptoms may not immediately present. After integrating the viral DNA alongside the host's genome, the cell's normal function may be disrupted. Typically, the immune system is capable of clearing the infection. If unsuccessful, there is potential for the development of oropharyngeal cancer as the infection persists. This is called squamous cell papilloma, and this will be discussed in a subsequent video. Several factors increase the risk of contracting oral HPV. This includes sexual activity, with behavior and the number of partners impacting risk. Other risk factors include gender, where men are more likely to contract oral HPV, age, with younger adults at a greater risk. Immunocompromised individuals are also at a greater risk of acquiring and developing a persistent infection, and smoking as well as alcohol consumption contribute. There are various types of oral HPV, with the most high-risk types of malignant transformation including HPV 16, 18, 31, 33, and 35. HPV 16 is the most common high-risk form and constitutes a large portion of situations where the patient can develop oropharyngeal cancer. Diagnosis includes understanding risk factors, symptoms, and the identifying signs. This is achieved through a detailed history and clinical examination, with assessment of signs for oral HPV. The medical history will involve discussion about the risk factors as well as sexual activity, smoking, and immune status. Additional tests involve a biopsy to assess if there are changes within the tissues. A HPV DNA test can also be done to see if HPV is present in the sample of oral tissues. With many oral HPV infections being asymptomatic and typically clearing without treatment, persistent infections usually require the following. Regular monitoring and dental checkups become crucial for early detection. If there's an observed change in the oral tissues, biopsies become an immediate priority. This vigilance is paramount, as oral HPV has the potential for malignant transformation. In addition to sexual preventative measures, reducing smoking and alcohol intake is essential, as both of these heighten oral HPV complications as well as malignant potential. For individuals who are immunocompromised, managing this with their medical practitioner is especially critical, ensuring that their body's defenses remain robust. Vaccinations also present another layer of protection against some of the most dangerous strains of HPV. If an individual has warts, then topical medications can be prescribed. To summarize, HPV results from direct contact with an individual's genital or oral mucosa who is infected with the virus. Typically being asymptomatic, oral HPV is common and can cause various secondary health issues, including oropharyngeal cancer. Prevention is integral, with vaccinations, lifestyle changes, and practicing safer sex. Frequent dental checkups are essential in early detection and management to increase the chances of successful treatment and prevention of malignant transformation.